Resuming debate, the honourable member for Courtenay-Alberni.
Thank you, Mr. Speaker. I'll be splitting my time with the good member, the MP for Edmonton-Griesbois. Mr. Speaker, last year the government's Health Canada expert panel on substance use, 18 esteemed experts in this field, they came together. They cited in their recommendations in their report that bold actions are urgently needed, including decriminalization, the development of a single public health framework which regulates all substances, and the expansion of safer supply. This is in response to the 25,000 lives that are lost, Mr. Speaker. The task force was mindful of 5 core issues: stigma, disproportionate harms to populations experiencing structural inequity, harms from the illegal drug market, the financial burden on the health and criminal justice systems, and the unaddressed underlying conditions, Mr. Speaker. Now, the Prime Minister just last week agreed that this is a health issue and not a criminal issue. And he already told the nation before calling an unnecessary election that his government would be informed by the recommendations of this expert task force. Now, we heard this in May of 2021. We heard from the experts and were informed by its nearly unanimous recommendations. I urge all members to consider these recommendations, Mr. Speaker, which mirror the measures proposed in the bill that I've tabled, Bill C-216, which is a blueprint for truly health-based approach to substance use. We agree on all sides of this House to consider the advice of public health officials in dealing with COVID-19 pandemic. And it's time now to act on the experts about the overdose crisis, which is killing increasing numbers of Canadians from coast to coast to coast, 20 a day, Mr. Speaker. We continue hearing from medical health officers from all provinces and territories, including our new good friend from the Yukon who's been advocating to tackle this issue in our larger cities, from law enforcement, and from frontline workers who struggle daily to save lives in the midst of this overdose crisis. And we hear the same advice from those who with lived or living experience, those who've used illicit drugs or continue to do so because of many reasons, including trauma in their lives, poverty, homelessness, or addiction, and from thousands of family members who've lost loved ones. On Thursday, we'll hear from the Chief Coroner of British Columbia as she reports on the numbers of overdose deaths in my home province for 2021. And while I dread her report, Mr. Speaker, I welcome it as more overwhelming evidence to act. The expert task force recommendations are straightforward and common sense. They're evidence-based and rooted in the fundamental need to save lives. Harm reduction, Mr. Speaker. And first, the expert task force found that criminalization of simple possession causes harms to Canadians and needs to end. These aren't my words. They come from this body of esteemed experts gathered together by this government to guide the actions needed to save lives. It's been more than 9 months and hundreds of deaths since the City of Vancouver applied for a Section 56 decriminalization exemption with the support of its medical health officer and chief of police. This is the exact same process Vancouver used to get the first supervised consumption site almost 20 years ago. The federal government of the day backed the city against provincial opposition as the need was so dire. They took courage and political will like we need now. The need is more dire today if that is possible. But for whatever reason, the Vancouver application, now joined by applications by British Columbia, the City of Toronto, sits on the minister's desk. Now, secondly, the government was informed by its expert task force that, I quote, as part of decriminalization, criminal records from previous offences related to simple possession be fully expunged. This should be complete, deletion, automation, and cost-free. And because those Canadians who are burdened with criminal records, Mr. Speaker, for simple possession of illicit substances, they often face insurmountable barriers to employment, housing, child custody, and travel. The bill that I've tabled calls for a national plan to expand access to harm reduction, treatment, and recovery services across Canada. Importantly, this must include ensuring low-barrier access to a regulated, safe supply for users, instead of leaving the drug supply to gangs driven to maximize profits at the expense of lives. We must support the domestic production and regulation of a safer supply that is readily available to users. Now, unfortunately, As these common sense reforms are supported on a daily basis by public health professionals, law enforcement, the media, frontline workers, and substance users and their families, they've been given very little attention by this government. This overdose crisis isn't identified in the mandate letter for the Minister of Health, barely mentioned in the Minister of Mental Health Addictions letter, and nothing in the speech from the throne. I ask all members to this House to take the politics out of the overdose crisis. This crisis must be treated with urgency, slow-walking essential reforms through protracted political and bureaucratic deliberation, or worse, ignoring them altogether, will only result in more preventable deaths. Thank you, Mr. Speaker.
Questions and comments?